Kent County Health Department is now updating guidelines when it comes to isolation and quarantine for COVID-19. For tonight's 7 conversation, I talked with Kathy Armstrong with the Health Department about what's being done.
Well, thanks so much for being here. I think it's important to first talk about some of the changes in the guidelines that Kent County is going to line up with the changes in the CDC guidelines.
So the Kent County Health Department has recently updated our guidance to align with the CDC's guidance on reduced isolation and quarantine for the general population. The CDC guidance changed the required time for isolation and quarantine to 5 days rather than 10 days for the general population. And it's across the board for 5 days for isolation and quarantine. And just a reminder, isolation is when someone has COVID and is staying home because they have COVID, and quarantine is who stays home because they're in close contact with someone who has COVID.
Let's talk about when the 5 days starts. Does it start when you have symptoms or when you have a positive test? Because some people are having symptoms and then don't have a positive test until the next day or so.
Actually, a lot of people are struggling to get tested right now. The at-home tests are difficult to find, and the testing sites are booked up ahead of time. So it may actually be many days before they can get in after their symptoms start. So we do use the onset date. For people who are symptomatic, we use the onset date for determining the 5 days of isolation. And we use the test date if the person remains asymptomatic while and then gets tested because of an exposure.
Okay, let's talk about then the days after that, what used to be the 10 days in terms of being back out amongst people and the importance of masking. And I know there's also a difference between the guidelines when it comes to vaccinated and unvaccinated. A lot to talk about.
Okay, sure. So right now the CDC says that if you complete 5 days of in-home isolation and quarantine, that you can return into the community after those 5 days, but you need to be wearing a well-fitted mask consistently the whole time that you're out in the community. We are recommending masking in public, and actually masking all the time in public, even for people who may not have been exposed, especially in the school system. The CDC strongly recommends masking, universal masking in schools. And so we are looking at them together, but also a little bit separately.
Okay.
And then as far as vaccines go, the vaccines make a big difference on what is required for people who are exposed. People who get COVID, it doesn't matter if you've been vaccinated or not. You need to still isolate for the 5 days and then wear the well-fitted mask in public for the remainder of that normal 10-day isolation period.
One thing that we really need to continue stressing is that if you are sick, stay home.
So we do recommend in all cases that if you're sick, stay home, regardless of how mild your symptoms might be, because the new Omicron strain of COVID seems to be showing a lot more asymptomatic people, as well as people who may have just those mild cold symptoms.
Yeah. Well, it's great information. We really appreciate it. We know that it is changing and really appreciate you continue to update us on those changes.
Thank you.